Diabetes and high blood pressure are out of control in the BVI, according to Coordinator for Health Promotion Services, Ivy George. She said the committee that is carrying out government's 10-year healthcare strategy to reduce chronic non-communicable diseases is meeting this month to look at a number of measures that are being put in place to help reduce heart disease and diabetes for a healthier population.
We are working first with government, where we have developed a structure that will lead to institutionalization and also other sectors taking a more active role. We talk about education. We have just appointed a new leader for the healthy workforce, that is the deputy director in Labor Department, and we should be meetings this month to discuss what are the areas we are going to be tackling under that area. Under the healthy spaces and places, we are working with Outdoor Trust from the UK, and they are going to be helping us to put in place in the Rotong area a Commonwealth walkway, which will be used for jogging and walking, etc. So that should be happening in November. Under the hospital, we have completed a 3-year action plan, and so we are just waiting for the primary care section of the Health Service Authority to roll out this plan, which would look at chronic and special emphasis on diabetes and high blood pressure, because these two areas are very much out of control. We have also been able to be a part of the Stanford University Chronic Care Self-Management Project. We have trained 14 persons.
Heart disease and diabetes is on the rise in the entire Caribbean region, as well as the cost for treatment. George said persons need to be more responsible when it comes to their health, and that behavior or lifestyle change is necessary to prevent or delay chronic diseases.
Chronic disease is not like when you have an acute infection or something. You go to the doctor gives you some medication, and it will go away. A chronic disease will be with you for a very long time. And so therefore, and it is your responsibility to manage that disease. You work with your physician, but you cannot leave it up to the healthcare people to do most of the work. And this is what is happening. A lot of our patients are not taking the kind of responsibility for their health that they need to. And that is why we are seeing so many persons using the dialysis machine, amputation, blindness, strokes, a lot of the cancers and stuff like that. If people would be more involved and in the terms of prevention, even in terms that if you have the disease, manage it in such a way that you could still live a healthy life. And so I'm saying that it is well established that chronic disease you can prevent, they can be delayed, and if you have a disease, that you can still live a healthy life if you do certain things.
Proper nutrition and physical activity from an early age is key to promote healthy lifestyle, avoid obesity and chronic diseases. A Caribbean Public Health Agency guideline for the feeding of young children is being implemented in schools under the Healthy School program that was introduced in grades 2 and 3 in 2015, and this year in grades 4 and 5.
Two things to me are very, very important, and for some reason we are not paying enough attention, and that is the eating healthy and physical activity, and it must start from in childhood. Like all other things, education will take the lead, and the Ministry of Health will support, provide technical support, and etc.
What programs you have in the school in that regard right now? There are some
Oh,
nutrition
okay.
programs in the school.
Yes, we have, and coming out of that, we have established one of our subcommittees is Healthy School Committee. So the people who are taking the lead in this whole school, strengthening of school health, is the school itself, because unless the sector in which these things fall take a active and a support, a leadership role, then you are not going to be able to see the kind of impact that we need. We have involved the vendors. Some have been more cooperative than others. We have also spoken to the parents about the importance of giving their children more wholesome food, because there is so much research out there that shows how you can improve academic performance and health of students by introducing more wholesome food and increasing physical activity.
A physical education curriculum has recently been introduced in primary schools, and George also said that work continues towards making People's Hospital a baby-friendly hospital.